Welcome to Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP, the National Association for the Advancement of Orthotics and Prosthetics. First off, let me say how disappointed I am that I cannot be there in person. I fully intended to be at the O&P Policy Forum today, and unfortunately I have a conflict with a client who's meeting at the exact same time, and I feel terrible. I really wish I were there in person. I will be there tonight at the Congressman Bishop fundraiser, as well as the fundraiser in the morning, and hopefully our paths will cross on Capitol Hill tomorrow. First, I want to say thank you to AOPA for hosting the O&P Policy Forum. This is an incredibly important 2 days in Washington. I want to thank everyone there for taking time out of their busy days, out of their practices, out of their running their business, and flying to Washington to do the heavy lifting of representing the O&P community on public policy issues here in Washington, D.C. I want to thank NAAOP as well as the other O&P organizations for supporting this policy forum. And I want to welcome and thank the students for taking time to come here and to learn more about what this policy forum is all about and to really immerse yourselves in O&P public policy and advocacy. It's critical to the future of the field. In fact, so critical that the NAAOP just this month announced the creation of a NAAOP fellowship for this summer. The NAAOP fellow will be selected competitively for a paid 10-week internship this summer to come to Washington and learn, really immerse themselves in orthotic and prosthetic advocacy and policy, and also in the context of the broader rehabilitation and disability policy environment. So we encourage you to apply. For more information and for an application, go to naaop.org. Now on to the substantive issue, the key issue that I've been asked to speak about. BIPA Section 427. I say this with a bit of a smile on my face because this is a law that passed 18 years ago in federal law. BIPA stands for the Benefits Improvement and Protection Act. Section 427 is the section of the law that says that Medicare shall not pay for custom fabricated orthotics or prosthetics unless they are provided by a qualified practitioner or supplier. And that term is defined in the law with some ambiguity, but it is defined. CMS needs to issue regulations to implement this critical provision. Unfortunately, they haven't done so to date. Well, they tried. Last January, CMS issued a proposed rule 8 days before the Obama administration left Washington. Comments were collected by March. CMS received over 5,000 comments on this provision and ultimately wound up withdrawing the rule. They withdrew the rule because they deemed it to be too burdensome and potentially costly on those exposed to the rule. They wrote the rule very, very expansively. They included all physicians, all PTs, all OTs, when in fact the rule itself, the language of the statute, does make some accommodations for those providers. Nonetheless, we have legislation in Congress, the O&P Medicare Improvement Act. You'll hear a fair amount of that this afternoon if you haven't already. Section 8 of that law requires CMS to finally issue regulations on this provision, BIPA 427, within 90 days. If we can get that passed, that will send a strong signal to CMS to stop messing around with this provision and implement the federal law. They have done a lot of work on this rule already. They really need to issue this in final form. We don't believe this is going to cost. In fact, if you really look at what the statute says, and you look at the fact that there are providers across the country who are not qualified under the law and yet are submitting claims for custom fabricated O&P care and are getting paid by Medicare today, those claims should not be being paid. And so we cannot imagine that this will not save money for the federal government. It certainly will limit or eliminate or at least reduce waste, fraud, and abuse. And we believe that it will dramatically improve patient care writ large. So we're strongly in favor of this provision. We can't understand why CMS has not implemented it, and we need you to bring that message to Capitol Hill again to try to make sure that people understand why it's so important that CMS regulate the federal law in this area. Section 8 of the O&P Medicare Improvement Act would do that. We very much encourage you to provide your own expertise in convincing your legislators and their staffs of how important this provision is and how CMS needs to move forward to implement the law after 18 years of being on the books. Thank you so very much. I really wish that I were there to be to meet you and greet you in person. Again, welcome to Washington. Have a wonderful week, and I will see you this evening and tomorrow. Thanks.